Thank you, Dr. Lau, and I want to thank Dr. Lau and Dr. Fescher for inviting me to talk to you about this today. I get asked about this every single day, multiple times a day in the Cancer Center. I work in melanoma, but I also work in the breast cancer clinic as well at the Cancer Center. So I get asked about this a lot. Let me tell you what I can't do, and then I'll tell you what I can do. I cannot tell you an herbal supplement that's going to cure cancer. Doesn't exist. If it did, make a lot of money. But I can tell you how to safely approach this subject and think about if you're interested, especially in the world where we have so much information. Talking about the Google is available to everyone. There's a lot out there. So how do you know where to look, what to see, and what to consider? So when we say herbal supplements, what does this mean? Because it means a whole lot of different things to people. Vitamins come under this category. Herbal teas, I actually, in talking with a patient before, said, well, it's just a tea. Well, it can make a difference as to what's in that tea. It's still going in your body. It's still being absorbed in your stomach. Protein powders, some are just that. They're just a protein powder. Some actually have a lot of different supplements, herbs in them, so you have to look at the packaging. Cannabis, marijuana, and CBD also all fall under this category, and I'll talk about this in a couple slides. Just traditional herbs that we think about, kind of pictured here, some that you might cook with. Supplements, though, how do they really fall under this category? They are not intended, so this is directly from what the FDA states, to treat, diagnose, prevent, or cure diseases. They kind of fall under this category, and because they do, there's very different regulation that we have with herbal supplements compared to the medications, prescription drugs that you take. Even vitamins, so even when you go to the store and pick up your multivitamin, vitamin C, they fall under this category where they just don't have as much regulation and standards. They have this Dietary Supplement Health Education Act of 1994, and all of this really states, it talks about like labeling, misbranding. So they don't have action proactively. So the FDA has action with our prescription medications before drugs hit the market. There's a whole lot of things that have to happen and things that need to be met for safety and to prove that they work. That is not the case here. And they don't even really have to necessarily prove safety unless there's a problem after they already hit the market. So they have no authorization to review it until they're already on the market, and then something can get reported. So that can be very tricky. Technically, herbal supplements cannot claim that they reduce pain, etc. They cannot make those claims, although they sometimes do. So here's a website if you just wanted to go to it. I know it's very long, but on the FDA, and they kind of talk about, they have an advisory list. It's not a very long list right now, and most of the supplements that are on there right now I don't get asked about much. But you can go there and actually sign up for alerts to hear if there's certain things that are being reported that are not safe. This is one of the most common things that I'm talking to patients about. I want to make sure that when you are buying a supplement or an herbal supplement that you're getting your money's worth. If it says 500 milligrams of vitamin C, it is 500 milligrams of vitamin C in it. Because technically they can put whatever they want in it. Since it doesn't have to go through FDA labs or any of those proven areas, that they don't have to put things in there that they say they do. But there is a way that you can guarantee that what you're purchasing has in it what it says has in it. And it's one of these three ways. So these are the three symbols to look for on the bottle. So the USP, which is in the middle there, that's the United States Pharmacopoeia. This is actually in laboratories where if a company or a lab or a investigator needs pure drug, like in its powder form to study, this is where they purchase it. So the USP is very adept at all the standards, the sterility standards, so you can be certain if that's on the label. Same with Consumer Lab, and then NSF International, National Science Foundation. So if these are on the label, these are nonprofit organizations that company sent their product to verify what's in there. So it's an unbiased source. Cannabis is a little bit different because it's still illegal in the United States overall federally, but not in the state of Michigan. How can you be sure that the product, where can you get good product if you aren't growing it yourself or don't have a trusted caregiver? If you go to michigan.gov's website and go to LARA, which is the licensing area, it will show you state-run facilities. With all of the regulation now that's in place with cannabis or marijuana, if they are a state-run, state-licensed facility, then that means that they are following the regulations. That means that they are sending their product off and it's being verified for what is in it, and they must give you that information. So whenever you're purchasing a medical marijuana or cannabis product from a dispensary, they have to give you this information. If they don't have this information, then they are not following the standards and they're probably not state licensed, and you do not want to go there. You do not know what's in it. There's a very short list that I can tell you off the top of my head of herbal supplements that I will not recommend any patient use. So I included some of those here. There's a longer list. If you go and look online for herbal supplements, there's thousands out there, which is why it's difficult for me to say, use this, don't use that. But I have a short list here that I think is helpful of things that you should not use. Any patient asks me about this, I tell them I recommend against it every single time. So graviola is one. There are Parkinson's-like symptoms, so it can cause neurotoxicity, very toxic. I just got asked about this the other day, so do not use this, please. Milk thistle. I know a lot of claims will have milk thistle as protective to the liver, but it actually can be quite toxic. When I used to work inpatient, I had a patient actually get admitted with liver failure from milk thistle. Paw d'Arco is another one. Can cause GI toxicity, stomach toxicity, and high bleeding risk. So patients can actually bleed out from using Paw d'Arco. This can come in a tea as well. This is when I was asked about this actually recently, where it was in a tea form. Just because it's in a tea, it's still going in your body and can still cause issues. I don't know how many of you have heard about vitamin B17. It's actually not a vitamin. It's called that. It's also apricot kernel or laetrile. These are all the same thing. So really from many stone fruits, not just apricots, have this in their pit, and it's cyanide. So poison. But I know patients do take this. It's often coming in from Mexico, and some patients are using it IV. So I recommend against this. I have had patients with cyanide toxicity be admitted to the hospital as well from using vitamin B17. So these are ones I don't necessarily recommend against, but these are ones I thought I would include some that I get asked about almost every single day. Like I said, there's thousands of herbal supplements out there, so it was hard for me to pick just a few, but I thought I would in case people had questions, but I can't. It would be a day-long talk if you wanted to talk about all the different herbal supplements that patients are taking. So turmeric or curcumin, a lot of you may use this in cooking. It is a spice. You can see it, the root to your right there. Turmeric is the spice that you'll often see. Curcuminoids are what's in turmeric. Most turmeric is about 5% curcuminoids. So if you're buying just curcumin, it just means they extracted that from the turmeric and they don't have the other things that are in turmeric. Can be beneficial. There's good anti-inflammatory data with turmeric for arthritis, but there are some concerns. So in some patients, you could have an increased risk of bleeding. I don't worry about this in everyone, but in some folks. It can decrease blood sugar, which can be good or bad. So if you are already on blood sugar decreasing agents, it could make it worse where it's scary. And then there's interactions that can happen. Statins, if you're on that for cholesterol, can have interactions with that, several other drugs. Way too many to list, so it's something that we would want to talk about on a case-by-case basis. Turkey tail is another one I get asked about a lot. It's actually not from a turkey or a tail. I have no idea how I got this name. It's a mushroom. So Coriolis is actually the mushroom. You can see it on the side there. Many mushrooms, they all have very similar effects. They're often thought to stimulate the immune system. So it's kind of thinking along the lines of immunotherapy, so it can have some of that additive effects. There's question with Coriolis. There could be some liver effects. It's tricky. As with many of these herbal supplements, we don't have the hard evidence that we do with the prescription drugs that we use for patients, for you guys. The data just, sometimes it's strong data, but it can be conflicting. So a lot of the Coriolis data is in patients who are already on chemotherapy and they saw some liver toxicity with it, but it's hard to know, was it the chemo? Was it the Coriolis? We don't know. So it's something we'd have to consider for various patients if it could be an issue or not. Vitamin D, falls under this. And I say, and for most patients, it's okay to take. We live in Michigan especially. We're not getting all the vitamin D that we should. So this is the general range of what most patients should take in a day of vitamin D. Vitamin D does get stored in your fat, which means if you do take extra, you don't just pee it out. So you do need to worry about doing too much. Wheatgrass, that's been one I've been asked about a lot lately. It something must have come out somewhere about it. In general, it's considered safe. There's not long-term safety data. Doesn't mean it's not safe. We just don't have specific data demonstrating, a couple years of use. And it can also decrease blood sugar. So again, if you're on those blood sugar lowering agents, could be a problem. Green tea, that's held on for a long time. Been asked about green tea, for the past decade. In large amounts, it's unsafe, and mostly because green tea automatically has caffeine in it. The large amounts of caffeine, not good for your heart. But in the doses that most folks are taking, 1 to 2 cups of tea a day, even if you're doing like the matcha green tea, just very concentrated, a couple times a day is usually okay. There are a lot of drug interactions. I didn't want to list them here because there's so many and it's very specific to different patient cases that it's not helpful to just generally list them all. And again, like the turmeric, it can increase bleeding in some patients, but that doesn't mean everyone. You have to have a bleeding risk already to begin with, and that can just make it worse. So it doesn't mean it's going to make you bleed like one of the other ones I talked about, but that it could if you're already at risk. So cannabis. This could be a whole talk unto and of itself, right? And I call it cannabis versus marijuana because when you talk about cannabis, it's really talking about the whole plant. And that's really what we mean when we're talking about it. There's THC, which is the psychoactive component from cannabis, and then there's CBD, which is the non-psychoactive component. There's some other things as well in there. There's THCA, CBDA, some other pieces that are difficult to find. So I'm going to focus just briefly talking about THC versus CBD. There is evidence for symptoms, for pain, migraines, seizures. There actually is a prescription medication approved for a very specific type of pediatric seizure, and that's cannabidiol, it's CBD. Epidiolex is the brand name. And we've had Marinol or dronabinol for decades, which is approved for some nausea, vomiting, and for appetite stimulation, and that is pure THC. We've had that for a very long time. So we have evidence that it works in those areas. What we don't have evidence on is that it's anti-cancer. There are studies being done. There's a lot of data actually coming out of Israel where they have product that's run in the country and the purity is verified in that country. So we have a lot of data coming from there. It's tricky because whenever you look at any trial that uses any type of marijuana product, you have to look at where it's coming from. So is it coming from a country where they have verified product where it's legal in their country? If it's coming within the United States, that's very tricky because we often don't know at all what's in it. It's a lot of patient report. You don't know what they're using, what's in the product. So it's very hard to compare and say, well, yes, we can use this for this because we don't know what was in it because it's not legal in this country federally. There's side effects. There was a recent paper, again, coming out of Israel. Like I said, a lot of the data with cannabis, good data is coming out of Israel, that actually showed some folks who got immunotherapy, the immunotherapy didn't work as well. And those patients using cannabis. They don't know why, but we did see that. And that is, we know exactly what product and the percentage of things that were used because it's legal in that country. So there can be drug interactions as well, depending on if you're using THC versus CBD or a combination product. And all of the vaping deaths have been in patients using THC. So I strongly discourage inhalation forms of THC, CBD. And if patients are going to use it, I prefer that they use the edible form. It's safer. It is federally legal in the state of Michigan. They don't have the recreational piece worked out yet, just so you know. I'm expecting that will happen in January. And it will be very different between the recreational marijuana and cannabis that's available and what's available for medical marijuana. There's going to be some dosing restrictions and some things that will come into play on the recreational side, just so you know. So overall, thinking about herbals, what kind of considerations? Drug interactions. There's a lot of things that can interact out there. So you really want to, we really need to know, your providers really need to know what you're taking and everything that you're taking so we can figure out if there's going to be an issue. Making sure you don't have toxic ingredients, read that label. So if you think it's just a protein powder, look at the label, make sure it really is just a protein powder and they're not putting other things in there. With the hidden ingredients, same thing, looking at that tea, seeing what's in there, read that label, and if you're not sure, take it to your provider and we can help figure it out. My approach is always do no harm. A lot of the herbal supplements, we don't have data on if it works to help with things. And so my approach is if you want to use it because you think it helps, that's your choice. But I want to make sure it's not going to hurt you or make what we're doing or your traditional therapies ineffective. Cost, I want to make sure that you're getting your money's worth. That's why I showed you those symbols. If you're paying for it, I want to make sure that what's in there is what's in there. Duplicate therapy, look at the labels again. I have a lot of patients who come in and they're using several products and they all overlap. Do they need all of that? Probably not. And then, like I said, the evidence. We don't have a lot of evidence for many of these on working well for cancer. Sometimes we have more data on them helping with symptoms, but not always as anti-cancer agents. That's a really tricky area. Here are some resources for you. So obviously your cancer clinic, make sure your cancer clinic knows what you're doing. Pharmacist, if you're seeing someone at Michigan, you always have me as an available resource. I get sent these every day, so even if you haven't met me, I've probably responded via the portal with my thoughts. Memorial Sloan Kettering also has a very nice website. It's free. I have access to a database through our Taubman Medical Library, but the public would have to pay a fair amount of money to have the same access that we are very fortunate to have as an institution. But MSK has a really nice free website with a lot of different herbal supplements on there. So if you wanted to quick check about something, you can go there and it kind of breaks it down for you. And it's free. Mayo Clinic also, I think, has a nice one. And with that, I'll turn it back over to Dr. Laura and Dr. Fisher. Thank you.